Hey friends, it's Kimberly here, Specialty Care Management and Reiki and Coaching. So have you heard about the butterfly effect? Where you can have butterflies from halfway across the world that the flutter and the movement of their wings stirring the air is felt across continents. Well, in like manner, in healthcare and specifically in specialty nurse coaching programs, we can create a butterfly effect for your group. And what happens in this aspect is that when you have, you might have one or two, maybe just a few members who are generating or at risk of generating the highest claims, they can impact the overall effect and the journey for the entire population. Everybody feels that impact at renewal. And when you can put programs in place that change the trajectory or that actually change the risk of this high cost member. So for instance, if I have a member who is at risk for dialysis, and when I can put that nurse coach at play, who can help that member change behavior and alter the course of that risk trajectory and reduce that risk, back that stage of kidney disease up, what you see is then that overall reduction absolutely benefits the entire population. People that will never ever know that you even had a CKD management program in place in the first place will benefit from this program. And that's because we're going after the folks in your plan who are either the highest risk or they're fixing to become the highest risk. And when you look at that risk of dialysis like a conveyor belt, it's a trajectory, it's a continuum. Some people are right on the precipice of dialysis. They're right on the cliff. They're getting ready to fall off into the dialysis chair in a high cost claim. And I've seen those claims be upwards of, I've seen them as high as $4 million a year. It's crazy. It's not uncommon to see charges of $1.2 to $2 million a year. That will definitely change. It's a butterfly effect in a big way, right? So, but when you take that member and you back them up and you create space between where they are in the dialysis chair because you're changing the root causes that are driving that risk, and you back that risk up, there's absolutely savings inherent in that process. And the longer term, the butterfly impact, the butterfly effect, in reducing the risk of the overall population and improving what that's going to look like for you at renewal. If you want to know more about how we